Disclosures for this and all episodes in this series can be found on the podcast series destination page located on education.webmd.com. The following presentation is copyrighted by WebMD Education. No use, broadcast, or recording of this presentation or any part thereof is permitted without the written authorization of WebMD Education. The following podcast is supported by an independent educational grant from Moderna, Inc.
Hello, everybody. My name is Dr. Greg Polin, and I'm a professor of medicine at the Mayo Clinic in Rochester, Minnesota. Welcome to this podcast episode entitled The Difference Between COVID-19, the Flu, and RSV. This is part of a 6-episode podcast series called What to Know About COVID-19, the Flu, and RSV. And today I am delighted to be speaking with Dr. Xanthia Wiley. Dr. Wiley, can you tell us a bit about yourself and the work you do?
Absolutely. And Dr. Poland, thank you so much for having me. My name is Xanthia Wiley, and I'm an associate professor in the Division of Infectious Diseases at Emory in Atlanta. And through my work and taking care of my patients, we're doing a lot of work on educating people about COVID-19, the flu, and RSV. And I think that many of us have seen a lot in the news lately about COVID-19, the flu, and RSV, and happy to be here talking to you about it today.
Perfect. That's great. And I'm very happy to have you here today because we're going to be talking about these 3 respiratory viral infections in some depth. So, Dr. Wiley, perhaps we can start with just a definition of what these mean.
Absolutely. So, we have been hearing tons about viruses lately, especially in regard to respiratory virus infections. And a lot of this is because of the COVID-19 pandemic. What I want everyone to know is that viruses are extremely small germs that are found essentially everywhere on Earth. However, a virus does not have everything that it needs to replicate or to make more viruses on its own. What it needs is to attach to and enter the cell of a host, for example, a human, us as hosts, and to use that host cell's equipment to replicate. And during this infectious process, oftentimes what happens is that the virus can cause severe damage or kill those host cells. Respiratory virus infections, when we talk about this, this is an umbrella term that we use for infections that are caused by viruses that happen in your respiratory system. So this includes from your nose to your sinuses, your throat, airway, and down to your lungs. And although some of these infections can start in the upper respiratory tract, some of them can even go to other areas like your airway or your lungs and can cause pneumonia. And I think many of us also know that viruses can affect other parts of your body. For example, let's think about COVID. COVID, yes, it can damage your airway and lungs, but what we also know is that COVID has caused damage in some patients' brains and in some people's intestines. Early in the pandemic, a lot of people had diarrhea specifically from COVID. So, knowing that it can affect all of these organs and systems, it's really important for us to talk about it and what we can do to prevent it.
That's a great intro. And COVID-19 is one of the 3 respiratory viral infections that we're going to focus on today, along with what we call the flu or influenza and RSV, which just stands for respiratory syncytial virus. So when it comes to respiratory viral infections, there are several different ones that can occur and be caused by different groups or types of viruses. The common cold is just one example of a respiratory viral infection, often caused by a group of viruses we call rhinoviruses. COVID-19 is another one and is caused by a type of virus called the coronavirus. And as Dr. Wiley mentioned, while it can start in your upper respiratory tract, the virus can damage many different organs and systems throughout your body, particularly if you're somebody at higher risk, which we'll talk about. And then, of course, as I mentioned, we have influenza or the flu. And this itself can be caused by several different types of influenza viruses that infect your nose, throat, and at times lung. The last one we're going to talk about in detail is respiratory syncytial virus, or RSV. This is yet another or different virus that can infect these airways. And while we're going to do a deep dive on these three, it's worth mentioning that pneumonia is a lung infection that can be caused not only by different viruses, but by bacteria. And sometimes those viral infections can actually predispose or lead to a bacterial infection. So keep that in mind. So, Dr. Wiley, I know people are probably wondering, when do I need to be worried about these viruses?
So, Dr. Poland, people need to be worried about these viruses right now. And it's important to know that these viruses, they do exist year round. So, yes, many viruses and infections can have a season. We think about the fall and the winter when they're most common in the United States. However, they can overlap and happen at the same time. And that's important because this means that we have more than one infection or illness at the same time. And I have cared for patients who have both a cold and the flu at the same time, or a cold and COVID at the same time. And it's important to know that getting one infection and getting sick can also make it easier for you to get sick with a different virus or another illness. Just like Dr. Poland mentioned, people who develop the flu can have a bacteria pneumonia a week or so after that. And if you get infected, it is easier to get sick with another virus. Also, what's really important to know is that anyone at any age can get COVID-19, the flu, or RSV. So you can be as young as an infant and as old as someone who happens to live in a nursing facility. So this affects all of us.
That's a very important point. Thank you for raising that. And it's also important to point out that while these are all different types of viruses, when you get sick, the symptoms of those infections, for the most part, are indistinguishable. In other words, you can't say, well, I have this symptom or this symptom, therefore it means I have this virus. It's very, very difficult to tell, and you really can't make a diagnosis just based on those symptoms. So when you do have symptoms that are upper respiratory in nature, I think the key point I would like to get across is that you want to contact your doctor or your healthcare team and let them know what's happening to you. And the reason for it, or the motivation for it, is to preserve your health and that of your family. And some of these overlapping type of symptoms can include things like a cough, a sore throat, or a runny nose, as well as general symptoms like headache and fatigue or tiredness. But the symptoms of these different infections can be very hard for someone to tell apart on their own. In addition, many people who get infected with COVID-19 or RSV, and even some who get infected with influenza, may have very mild symptoms or maybe no symptoms at all. And again, I want to stress, as Dr. Wiley did, that you can be what we call co-infected. So the symptoms are not the best way to tell which of any one or more viral infections you may have. And that's why talking to your doctor or healthcare team is going to be important.
Dr. Poland, absolutely. And it's also really important that we know that all three of these infections can be severe and even deadly, especially for certain people. A lot of people, when they think about the flu, they don't necessarily think that, they can die from the flu, but you can. And we've seen that COVID-19 can lead to symptoms, and they can be mild symptoms, up to severe illness and complications or additional problems that can be long lasting. I'm not sure if a lot of people have heard about long COVID. So, the symptoms with COVID-19 can last from months and we're seeing up to years. So, this can be a big difference, especially in people who are infected with COVID-19. It's also critically important to know that any of these respiratory viruses can be very dangerous for people who have certain health conditions, especially if your immune system is suppressed. And this can be from diabetes, from being on steroids, from receiving treatment for cancer. And if you're over 50 and haven't been vaccinated, you're also more likely to get more sick than someone who is younger. Again, just like Dr. Poland said, it is not always easy to determine the key differences between COVID-19 versus the flu or RSV just based on symptoms. Many times when people come to the hospital or they call me in clinic, it is difficult for me to know, oh, do they have COVID-19 versus do they have the flu? So a lot of these symptoms can overlap. Again, the flu can be severe and even deadly for some people. Complications can happen to anyone, but people who are over 65 or older, younger than 5, those who are pregnant or have certain health conditions are at a higher risk. Also important to note is that with RSV, most people, especially healthy adults, may have mild cold like symptoms or may have no symptoms at all. However, people with heart disease, lung conditions like COPD or asthma, a weakened immune system, someone who's on immunosuppressants, those are who are older, especially over 65 years old, premature babies, or those who are 12 months old or younger, are all at a higher risk for developing severe illness. So, even though a lot of these differences are difficult to tell just based on the person's symptoms, what's really important is that you know who is at higher risk. And just like Dr. Poland mentioned earlier, making sure that you reach out to your doctor or your healthcare team member to make them aware of your symptoms.
I really like the way you kind of put that together, Dr. Wiley, and summarize that because it's just very true. Both of our clinical experience would bear that out, that we do see people get into trouble sometimes pretty quickly, critical trouble with these viruses. So knowing that we're in the respiratory kind of flu season, it's important to talk to your doctor, find out how high of a risk you are, whether it's by age or medical condition or treatment that you're getting. And if appropriate, then getting immunized, for example, against influenza and COVID-19, and ask them about ways that you can protect yourself and those around you. And remember, because these viruses can spread through the air when someone who's infected talks, coughs, or sneezes, we need to think about if you do have illness, whether you need to stay at home, for example, not go to school or work, wear a mask, socially distance. So get in contact with your doctor or healthcare team if you're having any symptoms or if you're at high risk, if you think you've been exposed to those viruses. And just to make the point, the overlap of symptoms between the three viruses we're talking about is so substantial that getting tested is really the only way to know for sure which virus may be causing your infection. And that's important because there are specific treatments based on what infection you might have.
Dr. Poland could not agree with you more. So, everyone, if you have fevers, if you're feeling poorly, it is very important for you to call your primary care doctor, if you have one, or a healthcare team member, and they will advise you on the next steps. We're also fully aware that everyone does not have access to a primary care doctor. So, if you're listening to this, and you don't have access to a primary care doctor, always know that urgent care facilities and the emergency department are available in cases of emergencies and if you are extremely ill. This is also the case if you are the care partner or caregiver of someone who is sick or may have been exposed. It is important for those of you who are listening to advocate for those people, loved ones, friends, colleagues, coworkers, neighbors around you. Advocating for them is going to be important as well. So, if you or someone in your household has symptoms, especially if there's a higher risk of severe illness, or you're going to be around someone who is at a higher risk, you want to talk to your doctor and you're also going to want to see about getting tested. Could not agree with Dr. Poland more, especially with COVID. If you are tested early, you reach out to your primary care doctor or seek care early, there are treatments that are available to decrease your likelihood of progression. Also, we all know that these viruses can exist in water droplets that form when someone who's infected talks, coughs, or sneezes. So then you can get infected when these droplets enter your eyes, your nose, or your mouth. For instance, when you touch your face or you're sharing the same close space or airway with that person, then you can contract the virus. And also, it's really important to know as well that sometimes the most infectious a person can be is even before they have symptoms. So it's really important to have these great habits, whether you're feeling poorly or not. And RSV can live on objects and surfaces, so that's another way that it can spread. So it's important to wash your hands.
Really well said. And these are important ways that you can protect yourself and others that don't cost anything. Covering your mouth and nose with a tissue when you cough or sneeze. If you don't have access to that, coughing or sneezing into your elbow. Wearing a proper mask properly is extremely effective during respiratory virus season. Washing your hands well with clean running water and soap, being sure to get all parts of your hands. You want to do that for at least 20 seconds. You don't have to overdo this. The same with cleaning frequently touched objects or surfaces if you're sick, let's say at home, and you're sharing a bathroom. You may want to clean the handles periodically during the day. But again, you don't have to overdo that. All of these help prevent the spread of the respiratory viruses that we're talking about, along with getting tested quickly. Remember that treatment for a number of these viruses is ideally instituted or started within 3 to 5 days at the longest in some cases. So it's really important that if you're high risk and eligible for treatment, that you get tested if you have symptoms of a respiratory virus. But the only way to know how to treat you or whether to treat you is by getting tested and knowing what virus or viruses you might be infected with.
And I really want to stress what Dr. Poland just said. It is so important to make sure that you, your loved ones, get any recommended vaccines because this is such an important way to help protect you and those around you as well. And the way I tell my patients and my family members is that by getting vaccinated, again, not only does this help protect you, but it helps protect those around you who may be vulnerable, who may have a suppressed immune system, who may be really young, may be pregnant, may be of advanced age. So it's not just for you. So if you have any symptoms or you think you've been exposed to COVID, the flu, or RSV, contact your doctor or seek care if you don't have a doctor, especially if you're at higher risk for severe illness or someone around you who is. You want to ask them in advance what vaccines and booster that they recommend for you and when should you get them. So I always advise my patients to ask their primary care doctor, am I up to date on my vaccines? Is there something that I'm due for today? If I'm not due for it today, when can I come back and get my vaccine? Because for many of these infections, we have vaccines to help prevent infection and not just help prevent infection, but really important to help prevent severe disease. So, getting the ones that your doctor recommends is going to be critically important in helping to protect you and those around you. And this includes getting your full vaccine series, for example, your COVID vaccine series, and also receiving any boosters, and particularly the updated COVID boosters. So when they're available for you, please go out and seek your vaccination.
All superb advice, Dr. Wiley. And this has been a great discussion. For our listeners, you've been hearing from a top notch expert who is literally in the trenches dealing with these viruses every day. So I think you can take the advice that you're hearing to heart. Dr. Wiley, Thank you so much for joining me today. Any closing thoughts that you might have for our listeners?
Absolutely. So, Dr. Poland, it's been awesome participating in this with you and sharing knowledge to our community. So, my final thoughts are getting vaccinated is not just for you, but it is also for those who are around you so that you can protect not just yourself and your loved ones, but also those who are vulnerable in your community. Also, want everyone to know that as of right now, the COVID vaccine boosters are available. If you don't have a doctor, these are available often at your local pharmacies and your local drugstores, and sometimes even your health department. And also for flu vaccines are available for over the age of 6 months. Of course, always seek advice from your primary care provider. So, thank you for having me, and I hope that we all remain healthy.
And thanks to our listeners as well.